Good evening. The news gang is here, and tonight, tracking the virus across borders. What's driving up the numbers? The COVID-19 test of time. Why is the government falling below its targets? Also, the show tonight, the political pandemic is back. We discuss the outbreak in Jubilee and the president's containment measures. On the kicker tonight, a mother's love runs dry. The memo is in the Abadeas to find water for Nairobi. The punchline is asking if a flood of graft is in the offing. The angle has three sides of the COVID-19, and you're right. If you take it that Yvonne is away tonight, because she's on a short break. Let's start the show right now. And today I'll start with you because you are very close to me.
Yes.
I'm used to being somewhere in the middle all by myself. But anyway, we've seen the numbers rising, not as fast as they did a couple of days ago, but all the same a worrying trend coming from the borders. Many times when we saw those trucks going across the borders, we'd be worried about whether what they're carrying is legal or is not. But now we're worrying about something else when we see those trucks.
Absolutely. And the worry is twofold, locally and internationally. Locally because we're still talking about community transmission. Community infections. And though the numbers may not be rising as high as they have previously, but also take note that the number of tests is not as high. So when you have about 1,000 tests and you return 30 positive cases, then it's still something to worry about. And more fundamentally, at the international level, when we have our borders being the next red zones or hotspots, there's a cause of worry there. And the dilemma is, do we cross the borders completely and ensure that no trucks go in and out? But at the same time, the destinations are also our main trading partners. We still need that income. We still need that foreign exchange, but we also worry of the infections. So it's a dilemma, and how we get out of it remains the ultimate question.
Yeah, and we will talk about the testing a little bit later. But Lina's interesting, this whole issue of borders, because it seems to be exposing something that is not working within the EAC. Because one would imagine this is a community, there are protocols that govern how the countries in the region relate. Why would we be seeing this kind of discrepancy in where testing is done, who does it? This side will do testing and the other side is not so sure. The other day we saw a meeting of heads of state, and Tanzania and Burundi were not even represented.
I think with hindsight, Joe, the heads of state in the East Africa region may regret the approach they have taken, because they have given the regional initiative a late start. It needed to have kicked in immediately. The international travel started becoming a problem. When international flights were being stopped, the next thing should have been to watch our borders. Mm-hmm. And when it comes to the East Africa region, some countries have been very clear-minded on what they want to do and how they want to achieve it. And I must point out Uganda at this point, because remember, they immediately locked down the Entebbe International Airport. They've also been very strict at the border of Malaba and Busia, and they know exactly who is going in. And remember, the issue of trucks started with scrutiny and being paid, more scrutiny being exercised by Uganda. When it comes to Tanzania, we all know there's been quite an unconventional approach to this whole COVID situation. Tanzania has clearly taken a different approach compared to its neighbors. Remember, there social distancing is not an issue. People still go to churches, they go to mosques and all these places. And now...
And they don't give the numbers as regularly as
they don't give the numbers as
regularly
as you can. Now, you mentioned Burundi, and Burundi is a comical inclusion here. And you know, they are not just not attending that meeting, they're planning elections in a short while.
They're attending to other things.
Yeah, they're attending to other things. They are proceeding as if everything is normal. And why this should worry us is because analysts are saying the pandemic is yet to settle in Africa. It's still at its very initial stages. Remember, Africa accounts for only 1% of the entire
global
number
numbers,
global infections. Is this a true picture of how the pandemic actually works? No, it's not. It's just that the virus is at its initial stages, and we have a lot of reason to worry about some of the attitudes around the region, be it that of Burundi, be it the porousness of some of our borders.
Interesting, actually, there was actually an even more comical twist to the Burundi case when 9 days, I think it was, to the election, which is happening on Wednesday in next week. And then they said that international observers are free to come, but will quarantine them for 14 days. So, you know, by the time you leave quarantine, perhaps the results have been announced. But Jamila, the regional effort, a big concern, isn't it? Because this is not something that respects borders. And given that there is movement across our borders that has to continue anyway, as Gashuri was saying, that Uganda, for example, is our biggest trading partner. Some people usually think it's some European country or other, but our biggest amount of trade actually happens
with Uganda,
within this region.
That's true, Joe. And remember, the executive emergency director of WHO, Dr. Mark Rana, has told us that this virus is here to stay. Itakaa kwa muda mrefu, almost like how HIV has stayed. And we should be worried.
Endemic means forever present. It's not going anywhere, yeah.
And we need to be careful with the borders, considering the fact that in the past 4 days alone, we've had 59 positive COVID-19 cases in the borders. But surprisingly, it's with the borders with Tanzania. That's at Namanga, Isebania, and Oloitoktok. And I was speaking to a reporter in that area, and she was telling me residents of Namanga are worried because there are a lot of panya routes there that people are using, going to Tanzania and coming back. So Kenyans are going to Tanzania and coming back. Tanzanians are coming to Kenya and going back on the panya routes. What is worrying most of the residents in that area, some who have in the Nyumba Kumi initiatives, they say a lot of workers like the house helps who go and come back, or people who work in some of the shops in Namanga town, their labor is cheaper than it is for Kenyans. So they're employing the Tanzanians who come across the border in the morning, work and go back in the evening. And that is a worry for residents of that area. In fact, now they're saying because of the restrictions that are being put for trucks that are coming in, a lot of those trucks now are using the Taita Taveta route, which is less strict in terms of now testing the drivers who are coming in and out. Now, the other concern is now at Miritini. Remember, the government has set up a particular health centers where the truck drivers can be tested. We've been doing the Miritini stories for the past 2 days, and frankly, just even before the testing had begun, residents of Miritini had complained about having the drivers being tested at their health center, which is right in the middle of residential area. The residents were telling us they even have women who are expecting, who go there for their prenatal care. It's the same health center that they take their children. And now, since yesterday, the testing has begun. About 100 drivers were tested yesterday. That's the maximum number that can actually be tested in a day. 500 of them had appeared at the health center. And then there was only one person who was testing in the morning until around early afternoon when the county sent a second person to test. That's still not enough. Now, what is more worrying is the fact that most of these drivers are coming from different areas. And they're coming from Bamburi, they're coming from Changamwe. So they take matatus and they drop off at a particular point and then take a boda boda all the way to Miritini. And they wait there for their turn to be tested. They eat at the vibandas which are there. Wanatangamana na watu walioko hapo. And after they're tested, they go back. And then after 48 hours, they come back to get their results. During those 48 hours, they're okay. Wanaendelea na maisha yao kama kawaida. So now there's that worry about these drivers, whether they're positive or not, mixing with people. And it's the same situation in Namanga. Wanatestiwa, they go, they spend days in the town, the 2 days, until they get the results. So these are some of the concerns that are being raised in Miritini and in Namanga in terms of now the testing.
But it looks interesting, Francis, even as you come in, that in the East African community, we've been talking about many things. We are talking about a common market. We are even gunning towards a common currency. We are even talking about political federation. And we have all these protocols that we have signed. Yet this is something that is an existential threat, basically, because it has the potential of changing life the way we know it. It actually has done that the world over. And it does seem that we don't seem to be able to work together in the region, it seems to me that the presidents in the region surely should be doing more, because this is the kind of thing that it doesn't help for you to be okay all by yourself, because for as long as you cannot control that long, porous border that we share, for example, with Tanzania, it doesn't quite matter what we do on this end of the border, because, I mean, if people get sick on the other side and then they find ways of crossing for whatever economic reasons that Jamila was talking about, obviously that is a risk area, and you don't manage it by just trying to catch people across the border, because you will not get all of them. But it probably might be better if you're dealing with a situation where the other side are doing testing, this side is doing testing, it's coordinated, you know what the other people are doing, they know what you are doing. But here it does seem to me now that we are in a situation where almost, I mean, everybody is trying to do their bit and hoping that the next door neighbor is also doing as much. That is really not going to help us. What, in your view, does this really say about the EAC? Because it can't just be a place where people meet and talk. This is that moment where the EAC needs to be seen, isn't it?
There's something that the COVID-19 situation is doing to us every day. It is exposing those things that we had hidden for quite a while. They're now being laid bare. We initially started by saying it is exposing the state of our health sector in this country. At the regional level, it is exposing the level of trust and ability to work, or lack of it, and the ability to work together to deal with situations. And look, ours are like hearts. One here, another here, another here, and another one here. You can do everything to contain a fire in your heart. But if your neighbor is doing nothing about it, then surely the fire in their heart will spread to yours, certainly. No matter what you try and do there, no matter what we do here locally to try and contain the spread of the virus, as long as our neighbors are not doing enough, or even better, it means our efforts will be futile, so to say. And some years back, I covered a function in Dodoma. And you remember that mantra by President Jakaya Kikwete, coalition of the willing. You remember that coalition of the willing story? And this now exposes once again some of the things that were being said then about that coalition of the willing. And unfortunately, much as we were talking about a joint economy, a borderless society and region, a political federation in the offing, the situation that we are in, especially with the coronavirus, there are no options. We have to work together. If not, then we will perish together.
You see, Joe, just to add to what Francis is saying, what has been happening is African states have been walking to the stage at different times and slowly, basically. Remember, we all started from the point of view that probably this cannot be an African problem. I remember right here, even here in Kenya, when we had Wuhan and the virus spreading in Europe and America, some of the things that are being said here were ridiculous, because you would find people saying, could the black skin be more resistant to this compared to Caucasian skins, for example? And things like that, which are very misinformed. And the pattern has drawn itself even in the region, because you can tell which country came first in the EAC. That would be Kenya. The second one would be Uganda and Rwanda. And the three immediately went into big-time measures to control the spread. Now, the challenge again with Burundi, and it gets getting complicated, because we have these reports coming through that they've expelled and declared as persona non grata the WHO representatives. First of all, the futility of that, because WHO is a UN body, and UN is not a state, so you can't declare them persona non grata. They are not representatives of a state; they are representatives of the UN. But look at that. You're doing that at the same time conducting elections. There is no social distancing. You're not checking the borders. It is complicated. But what again it reflects is what is the political situation in those respective jurisdictions. In Burundi, Burundi's political situation is constantly unstable. You'll hardly ever see President Pierre Nkurunziza leaving the country, let alone participating in big conversations like this one on COVID. So that is also affecting how countries are responding to this pandemic.
I think another way we need to be talking to each other, Joe, as countries who are neighbors, is with the testing. You need to have a standard way of testing being done. What I mean by this is that if someone is tested in Miritini, when they go to Jinja, they should not be tested again, because the certificate they'll carry should be valid in Tanzania or in Uganda, or Tanzania now, and maybe Rwanda. And that is very important because of the relationship we have in terms of trade. And we do need those borders to be open, because we need the goods. We need those to be brought in, and for our goods to be taken to those countries because of the relationship we have in terms of trade. But now, coming back to Kenya, and the testing we are talking about, a recent article in the Daily Nation by Angela Okech talked about KEMRI, the Kenya Medical Research Institute, and how it is broke. And for me, that stood out as a bit of a worrying trend, because out of the 14 testing facilities we have, 9 are within KEMRI. So when you hear that KEMRI is broke, the 150, I think 8 million shillings that were given by the government is finished, it worries me in terms of how are we going to be able to test people in this country. You've noticed that whenever we test higher numbers, we get more cases, positive cases, as compared to when we test less numbers. That's what happened in Isili and Kawangware, and also in Old Town, when we started the targeting testing in those areas. And if we can have a letter that was written by the Danish organization Danida on screen, they had offered about 600 million shillings to the Kenyan government. But it seems like the money was going to be recalled, because there was no response from the Treasury in terms of now whether the money could be delivered to the Kenya government or not. And that worries me, because as it stands, KEMRI is asking for about 950 million shillings to be able to hire personnel, buy equipment, and do research for COVID-19. So tunapatiwa pesa na hatutaki, and we need it. So for me, that was a big question mark in terms of our seriousness in this war against the coronavirus.
But I thought at this point, Joe, Linas and Jamila, you need every coin. Any willing donor should be embraced without any delay, because every shilling is required. I mean, if, for example, KEMRI is suffering because of lack of funds, and here is Danida in a letter written to the National Treasury CS on the 8th of May 2020. I'm looking at the amount of money here. It's one batch is 350 million shillings to support level 2 and level 3 health facilities in the country. Another 150 million shillings to support an emergency water, sanitation and hygiene response towards COVID-19 hotspots in informal settlements within Nairobi County. And today we saw people, fetching water from a sewer line.
Yes, in Kibra.
In Kibra. And here is 150 million shillings that can go a long way in alleviating their pain. So either somebody is joking or has money and so doesn't need more money from donors.
Wow. And I think the issue of collaboration that you're talking about, Jamila, the reason why we would say, in the US, this is the number of people who have tested positive for COVID-19. This is the number in South Africa. This is the number in Egypt, because you are talking about the same thing. So there shouldn't be a situation where a test that is carried out in Kenya is not valid in Uganda, unless somebody is using juju and another person is using hot water or something. But if you are doing pure science, which is what this thing is really based on, then you expect that KEMRI would be talking to the Medical Research Council in Uganda, the National Institute for Medical Research in Tanzania, and all these regional medical research bodies, that they will be reading on the same script. They should be having Zoom, whatever meetings every evening to touch base, like, what are you doing, what is going on here, so that we don't have a situation where Mutai Kagwe, CS, and Dr. Moth are here expressing concern about what is happening with on our border with Tanzania and whatever. It should be something that is discussed at the level of the heads of state, and then they line up their troops at the various levels. The same way, for example, we have a security cooperation in the East Africa, where, for example, you would find if it's the movement of small arms and things like those ones, you find the DCI equivalent, for example, in the region meeting frequently to talk about security overall in the region, counter-terrorism, that sort of thing. Why wouldn't they have a situation where these people collaborate so that they agree that this is the test we are using, so that we don't have someone doing, I don't know, antibody test, another one doing molecular test, and then you start having debates about which test is which. I think that is a very weak point in dealing with this thing on a regional level, recognizing how much trade actually happens here, as we have noted here, that this is, I like what Linus was saying at the start, that, you know what, if we had said we're going to approach this thing as a region, from the word go, knowing that our movement within the region will still happen, whether we like it or not, it perhaps would have been a different story as we go now. When we come back from a break, because we have to take it, we'll talk about that issue of testing. The government has been talking about 3,000 tests per day. We haven't seen that. We had been told 250,000 tests by end of June. Right now we are about 36,000.
Yeah.
And we are not too far from June. I don't know if we actually can do 220,000
in less than a month.
In less than a month, you can do the maths. But let's take the break. When we come back, we'll do that testing. And remember, we talked about the political pandemic. We'll talk about that in a moment.